OxyContin's rise, examining Purdue Pharma's addiction profits. In the late 1990s, a new painkiller entered the market, promising relief for millions suffering from chronic pain. OxyContin, produced by Purdue Pharma, was marketed as a breakthrough, offering sustained pain relief with a clean safety profile. What followed, however, was a public health crisis of staggering proportions. Behind OxyContin's rapid rise lay a carefully orchestrated marketing campaign, aggressive sales tactics, and a series of regulatory and economic failures that turned a medication into a vector of addiction. Today, the story of Purdue Pharma is a stark reminder of how powerful corporate profit motives can shape and distort markets, and at what cost. OxyContin was first approved by the U.S. Food and Drug Administration in 1995. Its active ingredient, oxycodone, was not new. Opioids had been used for centuries to relieve pain. What set OxyContin apart was its time-release formulation, designed to release oxycodone steadily over 12 hours, theoretically reducing the risk of abuse and making pain management more manageable for patients. But the foundation of OxyContin's business engine was built less on medical breakthroughs and more on a masterclass in aggressive marketing and lobbying. Purdue Pharma, a family-owned company founded in 1892, seized the opportunity to redefine the prescription opioid market. The Sackler family, owners of Purdue, understood that chronic pain was an undertreated condition and positioned OxyContin as the answer. The big hook was simple and compelling: less pain, no addiction. Purdue claimed that the slow-release formula made OxyContin less addictive than other opioids. According to a 1995 letter to doctors, Purdue representatives insisted that addiction was rare if patients used OxyContin as prescribed. They cited a study from the mid-1980s that found low addiction rates in hospitalized patients receiving opioids. This study, however, was never designed to evaluate long-term outpatient use, nor did it address the high potential for misuse. With millions suffering chronic pain, back pain, arthritis, cancer-related pain, Purdue had tapped into a massive market. By the late 1990s, the United States was rapidly adopting aggressive pain management protocols. In 1996, the American Pain Society coined the phrase "pain as the fifth vital sign," encouraging physicians to routinely assess pain. The Joint Commission, a hospital accreditation body, followed suit in 2001, emphasizing pain control standards. These developments created a fertile ground for Purdue's sales strategy. The company launched a $200 million marketing campaign, going directly to physicians with educational materials, sponsored pain conferences, and incentivized drug reps to push OxyContin aggressively. The number of dosages sold skyrocketed from 670,000 in 1996 to 6.2 million in 2000, a nine-fold increase in just 4 years. Sales representatives were often given quotas and bonuses tied directly to the volume of OxyContin prescribed. Purdue's reps frequently downplayed addiction risks and promoted the drug for off-label uses where it had not been rigorously tested. Internal documents later revealed that company management was aware of the growing abuses and misuse, but continued to maximize sales. One key economic mechanism here was market creation through demand stimulation. By reframing addiction, a complex chronic disease, as a rare side effect and pain under treatment as a public health emergency, Purdue shifted physician prescribing habits dramatically. Opioids went from a niche treatment to a frontline solution for moderate to severe pain. This rapidly expanded the physician base that prescribed OxyContin, and in turn, increased patient demand. But the words "less pain, no addiction" turned out to be dangerously misleading. OxyContin was highly susceptible to misuse. Although the pill was designed to release oxycodone slowly, users soon discovered they could crush the tablets to bypass the time-release mechanism, creating a powerful, immediate high. This made OxyContin a target for diversion, abuse, and addiction. The real-world impact of OxyContin's rise was catastrophic. According to the Centers for Disease Control and Prevention, by 2000, opioid prescriptions in the U.S. had quadrupled compared to the mid-1990s. Correspondingly, opioid addiction and overdose deaths began climbing steeply. Between 1999 and 2010, overdose deaths involving prescription opioids jumped from 4,000 to 16,500 annually, according to CDC reports. Communities across Appalachia, Ohio, West Virginia, and beyond saw their social fabric unravel under a wave of opioid dependence. Families were devastated, healthcare systems strained, and foster care placements rose sharply. The economic costs were staggering. A 2017 report by the CDC estimated the total economic burden of prescription opioid overdose, abuse, and dependence in the U.S. at $78.5 billion annually, including healthcare, lost productivity, addiction treatment, and criminal justice costs. Purdue's profits skyrocketed alongside the crisis. By 2001, OxyContin accounted for most of Purdue's revenue, generating around $1.1 billion in sales. At its peak, OxyContin sales reached $3 billion annually by 2010. The Sackler family became one of the wealthiest in the country, with an estimated fortune exceeding $13 billion by the mid-2010s. This financial success, however, rested on a foundation of opioid dependency and systemic regulatory failures. Regulatory bodies struggled to keep pace with the rapid expansion of opioid prescribing. The FDA approved OxyContin's original formulation with surprisingly limited scrutiny on its abuse potential. Post-market surveillance was inadequate, allowing red flags to be missed. The Drug Enforcement Administration also faced challenges in balancing controlling prescription opioids without restricting legitimate medical use. In 2007, the federal government took a significant step. Purdue Pharma and 3 executives pleaded guilty to criminal charges of misbranding OxyContin, admitting they had misled regulators, prescribers, and patients about the risks of addiction. Purdue agreed to pay $634 million in fines, the largest pharmaceutical settlement at that time. Importantly, no criminal charges were brought against family members, and no financial restitution to victims was included. This did little to halt the opioid epidemic's momentum. By the 2010s, as prescription opioids became harder to obtain due to increased regulation and reformulation of OxyContin to make abuse more difficult, users turned to illicit alternatives like heroin and later synthetic opioids such as fentanyl. Overdose deaths from synthetic opioids increased over 50% annually in some years, propelling the crisis to new heights. Legal pressure continued mounting on Purdue throughout the 2010s and early 2020s. A spate of lawsuits filed by states, cities, and counties accused the company of deceptive marketing and negligence. Purdue's aggressive defense was not enough to hold back the tide. In 2019, Purdue Pharma filed for Chapter 11 bankruptcy as part of a proposed $4.5 billion settlement to resolve thousands of lawsuits. As part of the bankruptcy plan approved in 2021, Purdue agreed to dissolve the company and create a public benefit trust using proceeds from the Sackler family, who agreed to pay up to $4.3 billion over 9 years. Some $4 billion is earmarked for addiction treatment and prevention programs, and existing OxyContin sales revenue will be recycled to fund public health initiatives targeting the epidemic the company helped fuel. This chapter is still unfolding. Critics argue the settlement is insufficient compared to the scale of harm, in which over 500,000 Americans have died from opioid overdoses since 1999. The Sackler family remains under scrutiny for retaining significant wealth, estimated at $13 billion prior to the settlement, raising contentious debates about accountability. Zooming out, Purdue Pharma's story reveals much about the global pharmaceutical industry, regulatory oversight, and the economics of addiction. The opioid crisis in the U.S. was facilitated by a market structure where private companies had strong incentives to maximize sales of highly addictive drugs, sometimes at the expense of patient safety. Weak regulation and fragmented healthcare systems exacerbated this dynamic, allowing misaligned incentives to wreak havoc. Moreover, the crisis exposed the complexities of modern pain management as a medical and economic problem. Controlling pain is essential for quality of life, yet opioids, addictive potential, and societal costs require careful policy balancing. Alternative therapies and better prescribing guidelines have emerged since the early 2000s, but the legacy of overprescription lingers. Internationally, other countries have faced similar issues, but often on a smaller scale. According to the International Narcotics Control Board, global consumption of opioid analgesics is highly uneven. The U.S., representing about 4% of the world population, consumes approximately 80% of the world's opioid painkillers. This concentration underscores how particular regulatory and market conditions can amplify risks. The Purdue saga also illuminates the role of corporate governance and corporate social responsibility. Family ownership allowed the Sacklers to operate with considerable autonomy. Internal documents disclosed during litigation revealed strategic plans to maintain aggressive sales regardless of addiction concerns. Their case highlights the risks of limited transparency and accountability in private companies producing public health critical products. Finally, the opioid epidemic has forced policymakers, healthcare providers, and communities to rethink how economic incentives shape health outcomes. Federal programs like the CDC's Guideline for Prescribing Opioids for Chronic Pain 2016 and expanded funding for addiction treatment signal a move toward evidence-based policies. But the economic scars run deep. For patients, the crisis means confronting lifelong stigma, navigating fragmented treatment systems, and coping with the loss of loved ones. For taxpayers and governments, it means increased healthcare costs and damaged productivity. And for corporations, it remains a cautionary tale about how profit motives can distort medicine and plant seeds of systemic harm. The mechanics here were almost laughably simple. Purdue Pharma crafted a narrative minimizing addiction risks, flooded the market with aggressive marketing, and profited from expanding opioid prescriptions, even as addiction and deaths surged. This created a self-reinforcing cycle. More prescriptions led to more addiction, which boosted demand for opioids, both licit and illicit, feeding an epidemic with global repercussions. Understanding Purdue Pharma's role in the opioid crisis helps us grasp the broader dynamics between corporate interests, regulatory policy, and public health. It challenges us to ask, how can markets for critical products like medicine be structured to prioritize safety without stifling innovation? And how can economic incentives be realigned to prevent future crises born from unchecked corporate greed? At the end of the day, Purdue's story is a profound example of how a single product, backed by aggressive profit-driven strategies and lax oversight, can reshape an economy's public health landscape, and why vigilance and accountability in corporate conduct remain indispensable. If you found this story interesting, hit that like button and subscribe so we can keep making these videos. Tomorrow, we are diving into a story that is just as shocking: Petrobras, Brazil's $5 billion state oil corruption. You will not want to miss it. I will see you there.